Okay, here we go. Chapter 5, Theories of Aging and Physical Changes. So, changes with aging. Changes are intrinsic and extrinsic, okay? So intrinsic, which comes from within people. People grow from experience as a person. So these changes typically lead to, as we get older, wisdom and knowledge and coping skills that we've gained on the way. Extrinsic is coming from environmental factors such as exposure to smoke and other pollutants. So these things can add to the aging process. Triggers of aging are influenced by genetics or by injury or abuse to the body. So much like when you guys went to Brighton, you could see in some patients that their bodies were a lot more beat up, or they looked much older than what they were because of abuse that had been happening to the body. Nurses can learn how to differentiate what is normal with age and things that are not, and implement interventions for things that are not. So, biological theories of aging. Theories indicate that cells in the body become disorganized or chaotic. Cells no longer replicate, and cellular death can occur. So, we're going to learn a couple different things here. Error theories. Errors are accumulated in the synthesis of cellular DNA and RNA. With the accumulation of replication errors, cells are no longer able to function. So we've got three theories we're going to talk about here. These are the most common. So the first theory for error theories is wear and tear cell theory. This is where the cell errors are the result of wearing out over time because of continual use or trauma. Your next one is your cross-link theory. This is a stiffening of proteins in the cells. They become thick and sticky. So this would kind of think about how as the cells in the skin lose their elasticity, you could think about how, well, I guess that would kind of be the opposite, that it loses it, but like the arteries, for instance, how they become hard because they have gotten thick. So the proteins in the cells are no longer as flexible. They're thick, they're sticky, so it's harder for them to replicate and do the things they used to do. Oxidation stress, this is free radical, and this is the most understood and accepted of the theories. So free radicals, which are natural byproducts of cellular activity, and these are always present. Free radicals free radicals can cause damage to molecules in the cells. All right, so environmental pollution increased the production of free radicals. Internal stressors cause an increase to free radicals. Damage from free radicals occurs at a faster rate than cells can repair themselves with increased age. Therefore, the damage will cause a cell death before the cells can rejuvenate. If you guys end up with any questions about that, we can go into that in more detail. But the free radicals are the byproducts of cellular activity, and they're thought to be what's causing the damage inside the cells. Programmed aging theories. So this attributes aging to be at a predetermined or programmed at the cellular level. So basically, when the person is born, their date of death is already predetermined, and their body is going to last that long. So as more cells cease to replicate, signs of aging occurs. So as the hairs, the cells and the hair follicles stop replicating, then you would get gray hair. Ultimately, the person dies at a predetermined age, and each cell is born with a limited number of replications, then it dies. Here you have all the physical changes of aging. Actually, the next many slides are to do with this. So you have your skin, okay? Make sure you read through all of these and go through those. They'll be posted for you as well by the time this is up. But remember, look down farther. Thinning of the dermis causes a decrease in the stretching ability of the skin. So as an older person, what are we worried about? We're worried about skin tears because their skin can't stretch or it's thin. But make sure you read through all of this stuff for these different things we're going to go through. I'm not going to spend a ton of time in the slides on these. Your hair and your nails, again, everything starts slowing down. So the hair thins on the head. Pigmentation is lost, so the graying. The hair decreases on the body. Nails are hard and thick. Have you ever seen an older gentleman, typically many times, will have these just extremely thick toenails? And nurses do not cut toenails. That is for podiatrists. Even if the patient is asking us to please, please, please do it, we cannot do it, especially in the hospital setting. Your musculoskeletal changes, so aging affects the ligaments, tendons, and joints, which can cause the older adult to be more rigid and stiff with their movements. Muscle mass decreases and posture changes as a result of intravertebral disc that dehydrates. So, they start to decrease and not hold as much of their fluid in there anymore. So that's why it says they dehydrate. Cardiovascular changes. So we talked about blood vessels, arteries. Arteries become thick because they, your lipids increase and accumulate, but the heart no longer is able to stretch the way it used to be able to, and the blood vessels and the recoil is affected. The veins are stretched out. So the valves become less efficient. So again, as we're going through this in the older adult, everything just starts to slow down and not work as well as it used to. Respiratory changes. The recoil is lost. The chest wall stiffens. Gas exchange is less efficient, and think about our older adult who has smoked the majority of their life, even more so because so much damage has been done. So we've all seen, probably all of us have seen somebody with COPD. There's so much going on there. The effectiveness of the cough response is totally reduced. And this is anyway, not just because of smoking, but think of how much more those who have smoked for a lifetime end up with that same kind of thing, only worse. I'm really sorry about all the clearing of my throat and stuff I'm doing. I've been sick the last few days. So physical changes of aging, renal, the kidney blood flow decreases, the size and function of the kidneys decrease, urine creatinine clearance decreases, and then you got your cute little guys down there that are sad because they're not as hydrated as they used to be. They need some water. But remember, our older population doesn't take in as much water as they did as a healthy adult. Endocrine. So the glands atrophy and the rate of secretion decreases. So the rate of type 2 diabetes is higher in older adults because they're not letting out that insulin the way that they used to. The production and the secretion are both decreased. The rate of hypothyroidism increases as a result of changes the structure and function of the thyroid in the older person. So we may see older adults with a higher incidence of hypothyroidism. Reproductive. So you'll see there's quite a bit on this one as well, so I won't go through all of them. But obviously we know the older adult is unable to reproduce because their ovulation stops. With the ovaries, uterus, and cervix start to atrophy. In men, the testes atrophy and soften. Ejaculation is slower and less forceful, and they may experience low testosterone because the hormone itself reduces. And men may experience urinary retention. As an older adult, many men have trouble to getting their urine stream going. A lot of times this is due to an enlarged prostate. Gastrointestinal. So we've got teeth issues. Many older adults lose their enamel and dentin and makes them vulnerable to decay. I don't know really why I wrote that twice. But anyway, So many of our older adults will have dentures. I'm sure you've all taken care of somebody at some point now with dentures. You know, it's very important that we take good care of their dentures, and we also make sure that they have proper fitting dentures, because that actually ends up affecting their nutrition if they do not. Dry mouth is a problem because the saliva secretion decreases, on top of the fact that they're on so many medications that cause dry mouth. We've talked about that in the past. Stomach emptying is more sluggish. Peristalsis slows, and constipation is a common problem. Again, think back to the amount of water. They don't take in a ton of fluid, so and peristalsis is slowed down, so they will be prone to constipation. Accessory organs, so liver function tests are unaltered. Incidence of gallstones increases, and serum cholesterol level increases. So again, we're going to have buildup in the arteries, and then causing them to not be able to recoil as well, and harden and stiffen. Neurological conditions, brain size and weight decrease. Sleep disturbances can occur. Think about some of the older adults you may know that get up at 4 or 5 in the morning, and a lot of times go to bed fairly late as well. They just don't sleep as long or as much, and they definitely can have troubles with falling asleep and staying asleep. Balance difficulties, injuries increase as a result of a decrease in tactile sensation in the fingers and palms, especially if the person has some type of neuropathy from diabetes or other things. And then the risk for falls increases. We've talked about that as well. Eyes and ears. So the sense of smell, sight, and touch decrease. Near vision decreases, and the lenses thicken. Earwax is more thick and dry. Problems with earlobe sagging. Hearing loss can occur. So everything's decreasing here. Physical changes in the immune system. Immunity is reduced at the cellular level. We're unable to fight off the way that we used to as a healthy adult. Older adults will have a lower oral temperature, so sometimes you may get a lower reading. That may be a normal response just from their age, and decreased response to foreign antigens. So foreign antigens get in, and the immune system just isn't up to par and recognizes, so they're going to have a decreased response to those. Maslow's hierarchy. Physical changes affect all levels of Maslow's, okay? So think about how physical changes affect safety. You know, we just talked about falls. Love and belonging. You know, the patient may not have a good self-esteem, or not, or, you know, others may not feel the same about them as they get older. Think about the older adult who doesn't get a lot of visits from people and family. They don't feel like they belong or loved. And then esteem, you know, all these changes and getting older and seeing other people around them die. Of course, that's going to cause esteem issues. And then self-actualization, you know, either embracing it or hating it. You know, it's going to be one or the other at the self-actualization part. So we as nurses, we can help our patients with that. The upper level needs can be affected by inability inadequate or to adequately meet physiological needs. That's always the case with Maslow's. Okay, so that's it for this chapter. I will have the next one posted for you hopefully shortly here.